Thanks for having us here today to share our story and our thoughts with you guys. As being part of the Patient Advisory Committee, I was asked to come here today to share a story or experience that I had that might help us understand the stop-lying process from a patient standpoint. A little bit about myself. I worked in the healthcare field as a psychiatric nurse before starting my family. Now that I have 4 sons, I'm mostly a consumer of the healthcare system, as we spend a lot of time in merge and collarbones, concussions, you name it, we're here for stuff. But mostly my largest experiences with my second son, Jackson. He was born with a congenital heart defect. He's had 3 open heart surgeries, numerous procedures and operations. He's even airlifted out of this very hospital for medical care. But the story I want to share today is quite a simple one. But still I feel like it really touches on being comfortable to stop the line as a patient. And Gavin's going to share our story with you. So if you want to go ahead, Gavin.
Once I had a doctor who we thought I had a bladder infection, and we went to the doctors, and when he went to go do the checkup, he never wore any gloves or he never washed his hands. And after, he went onto his computer without washing his hands.
Yeah.
And I told my mom, that's gross.
So, yeah, the doctor had checked Gavin over from head to toe, checked through his privates and no gloves, nothing, and then proceeded to go type in information on the computer. He walks to the room, Gavin and I were both like, but why didn't I say something? Why didn't I say, you forgot to wash your hands, or can you wash your hands please? I don't know, like, was I didn't want to embarrass him? I still not really quite sure, like, but I knew it was an awkward situation, and it was getting more awkward me being silent. And when my 6-year-old son at the time can say, Mom, that was wrong, that was gross, like, you need to speak up. And so as a patient, I want to be here today because I want to see his generation speaking up and the lines of communication open. And as a patient, for me, I think we need to bridge that gap. And spending time in the hospital with my second son, we've seen things like this. And had this been on the wall in the doctor's office, like, could I have just pointed to it and done a, and that for me is a way to gap that bridge. Also, I saw in the stop lying handout that you guys have some stuff. The #1 thing was to thank somebody when they bring something to you. And I think having that done for me as a patient, if I would have said, could you wash your hands please? And I knew his reply or felt his reply would be thank you. It just gives such validation to me as a patient, and like I would feel more comfortable in the next time bringing forth those concerns. Because really all I want as a patient and for my kids' future is that we have those open lines of communication, and that we feel comfortable and validated in what we're feeling, and when a situation's not safe for us or our loved ones, that we can do that we can speak our truth and not worry about hurting someone's feelings or feeling awkward or embarrassed or anything like that, because that's really not what it should be about. So I'm really excited for the work you guys are doing here today. I think it's a great initiative. I think it will bring wonderful things, and I'm really excited to see what it does for our futures. Thanks for having us.
Thank you.